Hi, my name is Emma Stimpson. I'm an expert in natural health care for women and the owner of Women's Health and Hormones, a natural medicine clinic down here in Rosebud on the beautiful Mornington Peninsula in Victoria. When we're in clinic, we talk a lot about the different type of underlying causes that can contribute to a hormonal imbalance. And I guess that's really where our second top tip that we're going to talk about today comes in. If you imagine an iceberg, your symptoms are just the very tip of the iceberg, the section that's above the surface of the water that we can actually see. Your fatigue, hot flushes, mood swings, fluid retention, that foggy thinking that a lot of my patients complain about, weight gain, difficulties falling pregnant, recurrent miscarriages, heavy bleeding, spotting, and irregular menstrual cycles. Those are all symptoms of a hormonal imbalance, and that's what we can see above the surface of the water. Now, if you imagine an iceberg, of course, the symptoms are up the top. There's a number of layers underneath the surface of the water, and for you to see long-term improvements in your hormonal regulation, it's really important to identify and address some of those underlying layers. The first layer underlying the tip of the iceberg, or your symptoms, is of course your hormonal profile, which we talked about in the last video. Identifying your unique hormonal blueprint through a combination of saliva hormone testing and also blood work if it's necessary is really, really important. But of course, the next question is, well, why have my hormones gone out of whack in the first place? And that's a really important question. There are a number of other underlying causes. In order for you to see long-term improvements in your symptoms and in your hormonal regulation, it's really important to address those underlying causes as much as possible. The most common initial cause that lies underneath that hormonal blueprint is stress. Stress plays a major role in triggering hormonal imbalances, and often when we look at stress, it's the chicken or the egg. Are you feeling stressed because your hormones have gone out of whack? Or has stress that you're under in terms of your external life caused your hormones to go out of whack? And it's this vicious cycle that goes round and round. The second layer that lies underneath stress is nutritional deficiencies. Nutritional deficiencies are a really common secondary underlying cause for hormonal imbalances and symptoms that you may be experiencing, like low energy levels, hot flushes, mood swings, all the things that we've already discussed. Of course, underlying that is digestive function. If you're getting the nutrients into your system through the food, but your absorption of nutrients is poor, that can definitely lead to a hormonal imbalance. Chemical exposure is another common secondary trigger or causative factor for the hormones going out of whack in the first place. When I talk about chemical exposure, I do mean, of course, chemicals that you might be exposed through cleaning products, for example, but also cigarettes, alcohol, recreational drugs, and the chemicals that are found in our foods, pesticides, herbicides, the chemicals found in plastics that we use for covering and protecting our food sources. Really, really common sources of xenoestrogens, which we'll talk a little bit more about in video 3. So those are the secondary underlying causes, and we're looking at the layers of our iceberg that can contribute to our hormones going out of whack. If all we want to do is address our symptoms, we can do that, and that's called symptomatic care. And sometimes we can prescribe herbal and nutritional supplements without knowing anything about the underlying causes that will help you to feel better in the short term. Most of my patients want to see long-term improvements in their symptoms, and I always explain to them that addressing those layers that are lying underneath the surface of the water is one of the most valuable things you can do to see long-term improvements in not only your hormonal regulation, but also your long-term health and well-being. So there you go. That's it in a nutshell, pretty much, the way that we identify and address the underlying causes of a hormonal imbalance in clinic. Please feel free to call the clinic. We're ready to answer any questions that you might have. Thanks so much for listening. I hope you've enjoyed video 2.